Hi, this is Dr. Gal. I'm making this video for the staff of the Airport Animal Emergency Center. I would like to introduce VetNetSoft and I would like to show a couple of neat features. So this is the login screen. I put everybody's name or most of everybody's name here. What's interesting here is that when you see an envelope above somebody's name, like above my name, it means that I have received a message, an internal message from one of the staff members. So when I log in, which is easy, just click on my name and put the password in and log in. Then you will hear the sound, which sometimes drives people crazy, but it can be turned off. Also a blinking envelope here that means that I received a message reminding me, and when I put my mouse above this, then I see that I received a message from Tammy. Once I click on that message, then I see that Tammy just sent it to me, and it shows when I opened it up. So the message says that Dr. Gal, this client, called again regarding his dog. You treated 5 days ago. Dog is still lethargic. Please call him back. His cell phone number is here. The good thing about this system that these communications, these internal communications about the clients or hospital policies are saved permanently in the record. And also, I cannot tell Tammy that I did not read her message because it clearly says that when was the time I opened it up. Now I can reply to Tammy, or I can add a couple of other people. Let's say I want to also send a message also to Dr. Chef, and I either choose from the drop-down menu or I type in something that I call this client, and then I can type in that I called this owner and left a message 10 minutes ago. I can of course write more, but that's enough now, and just send it. So when I send it, then I can see that whom I send messages, what time, and when they opened it. They have not opened it yet, so very easy to send a message internally and records any incoming message and messages sent out. Fine, let's move on. So this is the we are in the program now. The interesting thing about VetNetSoft that this left column and this upper column always visible, so you know exactly what client you are treating, because only this data card area is called the data card is changing. So let's say that a client comes in John Doe, so type in, here it is, John Doe, and it was here before obviously, and bringing in Fluffy. Now I'm just trying to show how easy to make a medical record here. So as you see here, down here, diary, communication, vaccinations, medical record, dentistry, weight, laboratory, x-ray, surgery, basket for the invoice, so forth. So interesting that we can make notes here that only we can see, something about the client, good or bad, we can put it here, any vaccine reaction and so forth. So I want to, the client comes in with a problem, a fluffy. So click on medical record, and but you see that it shows that how many times this patient was here, because you see it on the left side. Here's the client name and what kind of animals the client has. If a client has 3, 4, 5 animals, you could see them here on the left side, all of them, and just click on the one, of course, you want to see. The interesting thing is that this system also records that what kind of diagnosis was made before, and very easy to look through the previous record. So when I click on, for example, earlier times, 2006 December 4th, then here is the entire medical record, the history, physical exam, the diagnostic and treatment, evaluation, differential diagnosis, and recommendations. And when I kind of scroll through here, just going down here, that what was happening with the previous visits, and it's very easy to, of course, it's just a test client, but it's very easy to see on the right side the different medical records, the previous medical records. And what I like about this program, that you are not losing sight of that he's the client, here's the patient, here are the visits, and here is the medical record. So it's pretty neat. Let's say that the client comes in and you click here, new medical record. So click on that, and templates are popping up. So that's this template I chose as the template I usually use, but it can be this template or some other templates. With this template, I think that's best for us. So click on OK, and here we are. You see that history, physical exam, diagnostic and treatment, and evaluation summary. And you see the same thing here, history, physical exam, so forth. So when you click here, reason for visit, then you are in the history section, and these are the history drop-down items. It's very easy to add a new drop-down items. For example, hit by a truck. You see here that if you want to add this hit by a truck sentence, then you have to just push here Alt Enter, and now it's hit by a car trauma, hit by a car truck. So let's say that, so reason for visit here, hit by a car trauma, for example, and you click here difficult breathing, check eye, so forth. So you see that by clicking here on this drop down menu, it's immediately building up your history. And of course you can just, it's like a word processing program, you can just come here and type in that whatever you want to type in, that dog is unable to stand on rear legs. Physical exam, you put the weight here, let's say 35 pounds, temperature here 102, 2 seconds, 2 seconds. And when you click on here, physical exam, then you see that you're already in this drop down, this physical exam drop down category, which you can just click here, and then you have several options. Either you type in whatever you want here freely, or you drop in something like let's say you type in whatever you, let's say an example, fear biter. So again, if you put Alt Enter, then fear biter comes here. So next time, just click here and general fear biter. You go on here, appearance, lethargic, still aggressive. Then you can go here, behavioral, capillary refill time. Okay, cardiovascular pulse weak. We've got cardiac murmur, digestive system. Let's say we have loose mucoid stool, painful abdomen. So as you see, as I'm clicking on this here, it's building my medical record, the physical exam, on the right side. So, and it depends on us how many drop down items we just put in. For example, ears. Let's say I say left ear has it inflamed, it has excessive hair, it's painful, pruritic, whatever you can drop in. Respiratory, we've got dyspnea, skin. So you actually get the idea. And of course you can just jump in here, and then you can just type in here whatever you would like. Now when you go to the diagnostics and treatments, what I like about that we are here now, and this is the entire basically inventory of items and services. So when you choose something, for example, you choose that exam, emergency exam, for example, and you want to radiograph, and what I like about this, that when you drop these services and items in the background, it starts building the invoice. So I don't have to type the invoice separately and then come here and then write in what the invoice consists of and put it into the medical record. Actually, I'm putting it into the medical record, and then I will show it to you that it's building it up. So let's say that I want to do CBC differential, dropping it in. All right. So here's, we could put in what we recommend, and diagnosis. For example, we put in a lot of diagnoses here, and so you can choose from here whatever you would like. For example, let's say we found that we have pneumothorax. I'm not sure if I put it in here. or not. Let's say that we have pneumonia. So puts it here, and we have I'm just playing with this, so just dropping things here. And let's say that this is not a diagnosis, but with the right click, it's I can put it in as differential diagnosis. So let's say I save it now. So here is my medical record, which is quickly done. Here's a differential diagnosis and also their diagnosis. Here I can attach pictures into the medical record. So for example, I want to attach pictures here. Let's say I've taken 2 x-rays, and let's say I did some surgery, just to put it in. So then immediately uploading all these pictures, x-rays and medical pictures, which belong to this visit. And once I'm done, I click here, and then I can email this entire medical record with the pictures to the client or the regular vet. So for example, I could email this to me as a test. Subject, let's say visit. So the system will put the owner's name here automatically. And I can preview this, how it would look like. Oh, it's the wrong one. So I don't have to preview that, just want to just send it. Visit. So I'm gonna send it to myself. And here it is. Send the email, and I can show you how it looks like, but it looks like this actually. So the entire visit with the pictures attached. So it's pretty quick. So let's go back now, and we've got all these items I put in here. Goes into the basket first. Basket because it's almost like a shopping cart on the internet. So first puts it to a basket, and you say, yeah, it's fine. It's $239.85. Then here, make the invoice. Here the invoice comes, and then how they will pay. Let's say the cash, pay with cash. Prepare the invoice, print two copies, and that's it. And all right, so we saved it, that's fine. One other interesting thing here is that right down here at the bottom, you see that we have 3 patients in a hospital. So these are the incoming clients, which half of them probably outpatient, half of them are going to end up in a hospital. And up here it says here also that who I have in a hospital. So double click, it also shows that if you want what kennel cage we put them there. And or you can actually, let's say a client calls and asking about Casey, so just double click on that, and now opens up the data card of Casey. So you pretty much see the entire hospital incoming clients and also hospitalized patients. There are many features of this program, and I'm not too good about explaining probably everything, but so let me show you. I will email you